Now that you have your MRI done, let's talk about the MRI report and the results. There are many things that the radiologist is going to comment on your shoulder. Their job is to look at your shoulder and find out all the things that look different than an 18-year-old shoulder. There's going to be a lot of wear in your shoulder depending on your age, and the goal is to figure out what is normal wear and what is pathologic or what is causing your pain. So just like your skin, you can get wrinkles in your skin or you can get changes in the color of your skin around your shoulder, but that's not what's causing your pain in your shoulder. Similarly, there's structures inside your shoulder that will have just normal changes that we see on an MRI, but that's not necessarily what's causing your pain. And that's not what we may need to worry about in the future. So let's talk about each structure and let's talk about what is common wear and what is not. So let's start with the AC joint. That is the joint at the end of your collarbone at the top of your shoulder here. That joint commonly has arthritis of some degree. Even people with severe arthritis of the AC joint oftentimes do not have any pain. So don't be so concerned if you see arthritis of the AC joint. Now, the glenohumeral joint, which is the main ball and cup socket of your shoulder, that joint is not supposed to be arthritic. And if there is some significant arthritis there, you may have pain from that joint. The other structure that is commonly talked about in your MRI results is the labrum. The labrum is a ring of soft tissue that goes around the cup of your shoulder and the ball sits inside it. The labrum keeps it from dislocating in and out of the joint. So if you dislocate your shoulder and there's a tear in a specific location, that can be very important and we may need to repair that. But more commonly, you can get some wear of that labrum. You can get partial tears or fraying of the labrum. And the most common location for that is the superior labrum or the superior posterior labrum. So those terms are commonly seen in your MRI report. Most of the time, that is just normal age-related wear that we don't have to worry about. It will not get worse over time to the point where, gosh, we regret not treating it. So the labrum may have some tears in there, and I will let you know if that's important and if that's the most likely source of your pain. But don't panic if you see that in your report. The most important reason why we get MRIs of the shoulder is to evaluate the rotator cuff tendon. The rotator cuff is made up of 4 tendons that come together and form one big tendon that is kind of indistinguishable if you just look at it on the end of the tendon. Now, that tendon can have little scuffing of the edges. And when the radiologist describes that, they will use the word tear. If there is a complete detachment of the tendon, they'll still use the same term, tear. So the trick is to figure out what tear is important and what tear is just minor wear. So if the radiologist uses the word mild or subtle when they're describing your tear, or they say it's a partial tear, that is typically normal wear. If it's a full thickness tear, where there's an actual hole in the tendon, then that is something that's more concerning, and that could go on to form a bigger tear. So we may have to treat that. So tears are described most commonly by the size of their tear, how wide they are, and how far retracted the tendon is. So that's very important. And sometimes the radiologist will say you have a tear of the supraspinatus and the infraspinatus. Now that doesn't mean that you have 2 separate tears. It's usually just one tear that's larger. And sometimes you might have a partial tear where just a few of the fibers are scuffed up and worn, and you might have a partial tear where it's just barely hanging on by a shoelace. So it really is important to look at the images and find out what kind of tear that is, rather than just looking at the description, because the description can sometimes be a little misleading. And I will let you know what my interpretation of the partial tear or the full tear is, and send you a message over my chart so you'll understand that better. Sometimes you can have just a little tiny partial tear where the tendon fibers separate a little bit, and it could be very minor, but when the radiologist describes it, they'll say this distance here is 2 centimeters, that partial tear. But in fact, the tendon still is attached, it still moves normally there. So don't get fooled by the size that the radiologist describes on their report. It's more important to know the type of the tear before knowing the dimensions of it. The last structure that we like to look at is the biceps tendon. The biceps tendon can be torn and detached from your shoulder and heal up in your arm. It can also be subluxed or move out of its groove. It's important to know this because if it moves out of the groove, it can be a source of pain. Now, some radiologists describe subluxation if there's just very minor movement, which could be affected just by the position of your arm. But other times it can be described as it's completely out of the joint, and that's very important. So again, I will review those images and let you know, is this subluxation or is this dislocation important, or is it very minor that is more to do with the position of your arm in the MRI scanner? So now you know the main structures of the shoulder that we're looking at: the AC joint, the glenohumeral joint, the labrum, the rotator cuff, and the biceps tendon. And they all have patterns of normal wear, and they also have patterns of pathologic wear. So I will let you know which ones are normal and which ones we have to worry about and focus our treatments on to get rid of your pain and to get you back to your normal activity. I hope this helps the next time you're reading your MRI report.